EMDR is an evidence-based therapy that is utilized primarily to process unresolved trauma. The EMDR itself stands for Eye Movement Desensitization and Reprocessing. Every time I work with someone, it just is amazing to see the progress they make in such a short time. A lot of the veterans in active duty have utilized it to process PTSD. It's also very valuable for childhood trauma that hasn't been processed, and it will help them process it very quickly and resolve that issue that's been probably there for years. EMDR is, the way it works is it utilizes bilateral stimulation. Like when we go to sleep and we have rapid eye movement, the REM sleep, our brain is going back and forth, left to right. It's processing what happened that day, and then it takes that information and it puts it into the memory of the brain where it's supposed to go. Trauma, unresolved processing, what happens is when you do the EMDR, that will take whatever topic they're talking about, it will attach to that, and it will process it and put it into the memory where it should have gone in the first place. So the person doesn't forget what happened, it simply removes the emotional aspect of it. And so it can resolve an issue that a person's had all their life within just a few sessions. Talk therapy will get the same results, but EMDR does it much more quickly. And it does it naturally. It's all natural. It's just the brain doing what it normally does. What happens in a normal session is, first of all, the clinician will get with the client and get a background history on them. It's really important to understand what their history is as far as trauma. When a client talks to the clinician, just to talk about events in their childhood, events that are going on in their life, because what they may think was normal may have been the trauma. So based on the individual person, their individual history, therapists will work with the individual to resolve the trauma one piece at a time. Another part of the EMDR is called resourcing. So at the end of each session, once they process that unresolved trauma, they will do what we call grounding, and that's simply to help the person be in a good place, when they leave that session, so that they're not overwhelmed, so that they're still not thinking about that trauma, because EMDR is so effective that it continues to work 2 to 3 days after the session. A lot of people have dreams, just not nightmares, but very disoriented dreams, very fast-paced dreams. They might dream in color very vividly. They might have memories that pop up, but if they do, that memory will be like a split second, blink of an eye, and it's gone because it's processed. And then within about 3 days, that person will start feeling like there's been a weight lifted off of them. They'll start feeling lighter, they'll start thinking clearer, because that issue that was there is gone. It's just phenomenal how effective it is. Like I worked with some veterans that had PTSD, like this one female came in and she had one specific incident. And for her, it was so overwhelming. We just did little baby steps because you don't want to do too much, it's overwhelming. And then the next time she came in, did a little bit more. And I could tell that incident with her just got smaller and smaller and smaller until it got to the very core. And then when we got to the very, very core of the issue, the last time that I worked with her, she just blasted through it. It was gone. It was gone. She no longer, and I've worked with so many veterans that had PTSD, that they worked through that issue and it was gone. It was just over. It was amazing. Trauma comes in many different forms, and it doesn't have to be one major event. Trauma can occur over weeks, days, months, years, and the person may not even realize that they've had trauma. Maybe it was physical or emotional trauma, but the person may not be aware of that because where they grew up or in their situation, it may have been just a normal situation. So they're not even aware of it. Until they get that information, then they're not able to even start processing it. To resolve trauma is an individual basis. It depends on the person and it depends on the trauma. A lot of times, for example, if a veteran comes in and they have PTSD from combat, that can also be compounded from childhood trauma. And that's another reason why the therapist talks to the client to make sure that they would be a good candidate for that. That's really important. You don't have to know what your trauma is before. A lot of people will come in for depression or anxiety. So if a person comes in and say, for example, I have anxiety, I don't know, I'm just having a stressful day, that's a good starting point because that stress is connected to something. It may be connected to trauma, it may not be, but you can try it, and if it is attached to trauma, it will come up. If it's not, it won't. And you can resolve that stress within a matter of minutes just by doing the grounding and the resourcing from EMDR. It's really good for that too. Well, some of the combat vets that come in don't know that they have PTSD. They may say, you know, I'm just anxious, I'm short-tempered, I feel angry. They may not be aware of it. And that, again, that's our starting point. And you just start with wherever they're at, and you start with the anger or the depression, the anxiety, and if there's PTSD attached to that, it will come up. So again, you just meet the client where they're at and just take one step at a time. Some symptoms of PTSD would be irritability, not being able to sleep. They may have nightmares. They may have reoccurring dreams. Very short-tempered, a lot of anxiety, depression is a big one. Maybe they're very impatient, hypervigilant. They can be just, if a door slams, they may jump at that. When they come into a room, they don't want to be in a crowd. They want to have their back to the wall because they want to be sure of their surroundings. So PTSD can take a lot of different looks, but the main thing is that that person doesn't feel like themselves. They can't relax. They don't feel normal anymore. And they don't like to be around people a lot of times. They're not comfortable in a setting like that. With addiction, a lot of times, not always, but a lot of times, there is trauma also attached to that. And again, the person may not know that they have the trauma. But if the trauma is not addressed and resolved, that will directly affect their ability to address and resolve their addiction. It all goes together, addiction, mental health, trauma, they're all connected. So I think treating the person as a whole is so vital because if we don't get to those core issues, then that person is high risk for relapse. And I've seen it over and over and over. And that's why I really love EMDR because it can do in a few sessions what it would take months to do in talk therapy. Contact Treehouse Recovery, they have tremendous therapists there that can work with each person on an individual basis, address not only the addiction, but that core issue, which oftentimes can be trauma. And if that's addressed, that will go hand in hand in helping resolve the issues that surround the addiction and help that person get into a healthy lifestyle and get sustainable recovery. That's why I love this field, is because you get to see people come in and they're struggling, and then you get to see them turn their life around into a life of recovery. And to me, it's a miracle. It really, truly is to be able to be part of that journey.